Hello, everyone, and welcome to the USBC Collective Impact webinar series, starting off 2020. Today's host, I'm Alyssa Spees. I'm the new Member Relations Manager for USBC, also joined by Amelia Pasmythe-Seeger, Deputy Director. So background on the series, started with funding from both the CDC and the W.K. Kellogg Foundation to support the bi-monthly webinars. So these webinars are held every 2 months in even numbered months, and they're on the 4th Tuesdays of the month from 2 to 3 p.m. Eastern. So this is just another chance for USBC to bring together state, territorial, and tribal breastfeeding coalitions, as well as national and regional organizations to share best practices and news about using the collective impact model for collaborative change. This webinar is free and open to all interested breastfeeding advocates. Topic and speaker details are posted a week or two ahead of each session on the USBC Collective Impact webpage, and you can see the link at the bottom of this slide. The webinar recording and slides are shared with attendees as well as posted on this webpage. And you can see it's www.usbreastfeeding.org/collective-impact. So many of you saw there's a new registration link for the 2020 series going forward, but once you are signed up, registered once, you are registered going forward, so you'll get the reminders of each session with the details as they come up. And even though not everyone may be able to attend every session live, the registration link will send you auto reminders so you can get updates and links to the recordings and the archives. So to find archives of past sessions, you can follow the link from your confirmation email, or you can go to that website that I read out earlier, that usbreastfeeding.org/collective-impact. So on our website, if you go to the Learning Collaborative header over to the right side of the screen, the USBC homepage, and you scroll down the Collective Impact webinar series, you can click on that page to get to the information as well. And a reminder that if you need a certificate of attendance for this webinar, the follow-up email that is sent to registered attendees will include a link to access the certificate for the specific session. So during today's session, all attendees are in listen-only mode. We will have time for Q&A after the presentation. We encourage you to submit your questions at any time they come to you throughout the presentation, and they can be typed into the questions box on your webinar control panel. So your webinar control panel should look something like this, and if you can't see it, you might need to press that orange arrow button to get it to pop back out, but you should be able to see the questions box to type in your questions at any point. If you're having any technical issues or other questions during this session, you can email office@usbreastfeeding.org, and someone on staff will try to help you get access. So I am excited to introduce today's presenter to you all. Calvin Williams is an inaugural member of Reaching Our Brothers Everywhere, or ROBE, Wisdom Council, and president of Lucian Families Incorporated, which is a Cincinnati, Ohio-based company that provides products and services to organizations that support parents, co-parents, couples, and families in improving relationship quality and functioning. Additionally, he is the Fatherhood Services Coordinator for the Hamilton County Department of Job and Family Services. Mr. Williams is a co-author of and master trainer for the On My Shoulders Fatherhood Curriculum, an innovative evidence-based program that equips fathers for success in relationships with their children and their co-parenting partners. He previously served as the Director of Fatherhood Services at Public Strategies Incorporated in Oklahoma City. Before joining Public Strategies, Mr. Williams was the Program Director for the Lighthouse Youth Services Real Dads Program and for the Services United for Mothers and Adolescent Fatherhood Project, which are both in Cincinnati. He is a founding and current board member with the Ohio Practitioners Network for Fathers and Families, which is a statewide training, advocacy, and support organization for fatherhood practitioners. We are delighted that Mr. Williams is with us today to discuss the fierce urgency of now and to offer reflections on how ROBE and Rose, reaching our sisters everywhere, intend to elevate the power of community as we work to eliminate breastfeeding disparities so that all families are able to achieve health equity. So with that, I will turn it over to today's presenter. Welcome, Calvin Williams.
Thank you very much. Hello, everyone. Let me get my screen together here. And we're going to hit show my screen and start the show. And we're going to make that go away. Okay, how are we looking? Look good?
Looks good.
Okay, so welcome everybody from Reaching Our Sisters Everywhere and Reaching Our Brothers Everywhere. And, are we thriving, these two organizations, or just surviving when it comes to our community engagement model? And actually the answer is we're doing a bit of both. We seem to, Rose and ROBE seem to be in increasing demand for content and presentations around the country. But at the same time, like any organization, we're trying to figure out how to sustain momentum and funding and make sure we're staying true to our mission and those type of things. So we're doing a little bit of both, but we're still here and we're doing the work, and that's really the most important thing. Okay. I'm unable to advance my slide.
That's correct.
Is there something I need to do?
Let's see. It could be either from arrows on your screen, or you could click up with your mouse. In presenter mode, usually either of those work.
Yeah, I'm clicking the arrows. I don't have a mouse. Clicking the arrows. Now let me go to escape.
You can also try the space bar.
Okay, let's try that. All right. It just takes
there
2
you
to 3
go.
minds. All right.
Great.
So Rose's mission is to normalize breastfeeding by serving as a catalyst that provides resources and networking opportunities for individuals and communities. And you'll see that mission statement being lived out in the work that I'm going to describe, because it's really important for Rose and ROBE to go into communities and be a part of connecting, linking, and networking individuals, organizations, allies, supporters to strengthen what's going on in that community. Rose nor ROBE go to communities around the country and offer solutions and answers, or try to be the experts. The people in the communities are the experts. We're there to support and help them achieve what they'd like to achieve in healthy birth outcomes, infant feeding, maternal morbidity, and mortality. So for our program, we're looking at breastfeeding's role in closing the gap. And there's 4 pillars to how we go about this work. And they actually line up Surgeon General's call for action. It goes back in 2011. So policy, programs, partners, and peers, that's what keeps us grounded in how we do things in order to have the biggest impact in local communities and across the country. So here we're looking at some really, it's actually exciting data, the 2016 data for rates of any and exclusive breastfeeding among children born in 2016. And so we see that there have been increases and improvements from 2015 in several areas, but we'll look at non-Hispanic Black, and ever breastfed is up 3.6%. I mean, that's a big news for the Black community and the breastfeeding goals that we'd like to achieve there. Breastfeeding at 6 months up 3.8%. Breastfeeding at 12 months up 3.4%. So you see these increases all along the line there for non-Hispanic blacks. And so one of the messages that Rose and ROBE consistently puts out is that black women breastfeed, and that little simple message is meant to counter biases and misinformation about black families when it comes to breastfeeding. So black women do breastfeed, but yes, we do have an issue with disparity, particularly with initiating and duration. But we do celebrate the good news for non-Hispanic black women and families that they're starting to breastfeed. They're breastfeeding for 6 months, breastfeeding for a little longer, and then even the uptick in exclusive breastfeeding, which is really, really exciting. So one of the things we like to do, we love to use media, print, visual, auditory, social, we use all types of media to inform and educate people and families and communities. So this is an example of one of the handouts that we created that is appropriate and describes the issue, the concern, and the problem in a way that can be easily digested. And so here we're putting out the information that suboptimal breastfeeding for black and Hispanic children puts them at greater risk for childhood disease and death than children who are breastfed for 6 months or more. And so we look at not only the potential illnesses or diseases that come about, but what they cost. Okay, so there's a cost for the high rate of ear infections for children who are not breastfed for 6 months or more, GI infections, necrotizing enterocolitis, SIDS, and child death. And so those disparities impact moms. Black mothers who breastfeed suboptimally are 1.4 times more likely to develop type 2 diabetes. So there are a lot of benefits to breastfeeding. There's an importance to breastfeeding for both mom and child. And what we're doing on the ROBE side, which we'll talk about a little later, is to talk about not only dad's role, but benefits to dad for breastfeeding. So those are other messages that we're getting out. And this is actually a picture of some moms. This was somewhat random. Two moms going to the library in Memphis, Tennessee, and there was another mom there. They were all breastfeeding, all had their babies, so they all decided to get together, sit together in the library and breastfeed their babies. So this picture illustrates what we'd like to see, which is the normalizing of breastfeeding in all the spaces that we're in. We're still dealing with the idea that this space or that space, the other space, is not adequate or appropriate for breastfeeding. But we are working hard with local, statewide, and national organizations to help change that to where breastfeeding is just the norm. And it should be done in any space where people are allowed to be. And so this is a picture that shows us that this is possible and what it can look like here in a library setting. So things that negatively impact breastfeeding, being African American, this is what the research talks about: poverty, being a younger mother, and being single. So there's less support for breastfeeding. So these are things that can get in the way of mom's decision and intention, much less her initiation of breastfeeding. However, Dr. Williams, David Williams, points to racism as a key factor in the breastfeeding issues that we have. Dr. Williams has developed 3 scales to measure racism. They're noted in a very popular TED Talk that he's done. So if you look at the disparities in the top left corner of the slide around median household income and race, We can still see that there are disparities across the board from the dollars earned by white Americans and those earned by others. The same thing for median wealth. For every dollar of wealth that whites have, Asians have 81%, 81 cents, blacks have 6 cents, Latinos have only 7 cents. So these large racial and ethnic differences are consequential for life, and they're not acts of God. They're not random events. One of the things that ROBE and Rose does and have to do is when we're engaging communities, we can't just be too narrowly focused on breastfeeding, because the families and community members that we're engaging, they have other issues that impact their lives, and we have to be well versed in those issues and be good listeners, and also consider those as important to us as well. The fact that these are not random events leads to the fact that they reflect the successful implementation of social policies, many of which are rooted in racism. And so that equity work, that anti-racism work definitely overlaps with what we're doing with families and communities around breastfeeding and maternal health. So disparities in breastfeeding, we coming right out of the Surgeon General's call to action. These are the things that, on the left, the things that the call to action pointed out as really important priorities. And so Rose is working to impact the categories as outlined in that report, such as the maternity care practices, working on a policy level, professional education, our Center of Excellence for Historically Black Colleges and Universities, workplace policy and programs. We're working with Moms Rising, child care, Ready, Set, Baby, access to support. So we have our CLC, RCT, and IBCLC prep that we do, information and education with partners and peers. That's in everything we do. Social media, again, is ongoing. Peer support, mother, fathers, partners, and family, and addressing infant formula, another policy area of policy work that we do with the United States Breastfeeding Committee. So challenges, healthcare professional skills, when we're talking about addressing racial inequities, the skills of healthcare professionals, safety, and the risk of formula feeding. These were all identified in a paper that Rose was a part of producing on addressing racial inequities in breastfeeding in the Southern United States. And actually that the Southern United States focus continues to play out in some of the work that ROBE is doing. We are currently under a Center for Disease Control grant, which has us looking at the 8 southeastern states and from a fatherhood perspective, and trying to figure out what's going on, what programs and services and initiatives exist in those states, and how can we help support those and pull together information from those states to have a wider dissemination of what everybody's doing in the Southern United States, where some of the disparities are really stark. So Rose participating in literature that also informs ROBE and how we go about the work that we want to do. So expert panels with Baby-Friendly Hospital Initiative. We've been participating in those panels for baby-friendly and are enjoying with everyone else the proliferation of baby-friendly hospitals from where we were 5, 10 years ago. So here is a designation or a sign that shows that Grady Memorial Hospital in Atlanta is a baby-friendly facility. So changing the narrative, we want to make sure that we are talking about the importance of breastfeeding as it relates to children's health. And and surprisingly, that narrative still needs to be echoed strongly. And now, as most of us on this call know, there are counter narratives around around breastfeeding that we have to be aware of and be smart about how we communicate the importance of breastfeeding to our families. And so we just make it simple, make it culturally appropriate, about the benefits for mom and baby in terms of reduction of risk of cancer, less frequent hospitalizations, breastfed babies less likely to die of SIDS, and then fewer ear, lung, and stomach infections. So just real good information in a simple format that's culturally appropriate for people to consume. Again, back to the pillars we stand on in terms of partnerships and peers. So here we want to expand cultural coalitions to meet the needs of the community. Black maternal morbidity is an issue that we chose to become heavily involved with. So this flyer here is an example of us gathering people in communities, peers, professionals, to share and to support each other in our goals around breastfeeding and maternal morbidity and mortality. So we do a lot of listening, engaging with public health systems, and students, and physicians. So this is a picture of Georgia State University and Morehouse School of Medicine pediatric residents who have been engaged by Kimmery Bug. And it's a real focus for Rose, and you'll see later on, ROBE itself is starting to step into this area by virtue of opportunities brought our way. But it's a real focus to educate the up-and-coming doctors. We see that as an area of opportunity, and given that very few in medical school or during residency, there is very little time given to breastfeeding as an infant feeding option. And so we take it upon ourselves to get into those spaces and provide education and information and encouragement for these pediatricians and other medical doctors and residents to really, really pay attention to breastfeeding so that they can help families make informed choices. Right? I'll talk a little bit about ROBE here. Our mission is to educate, equip, and empower men to be supporters of breastfeeding. And we really like to think about it of being supporters of breastfeeding in their families, for the women in their families who've made a decision to breastfeed. We'd like to educate men on how to be a part of making that decision to breastfeed, equip them with the information and knowledge that they need, and then encourage and empower them to let them know that they are a difference maker in initiation, duration, and exclusivity around breastfeeding, so they can help make the difference for their families to meet their breastfeeding goals. And here's just some picture references of the work that we do. This was actually in Atlanta, Georgia. The picture on the left there, that's me. You couldn't tell. And I'm actually delivering an On My Shoulders fatherhood curriculum training to two young men that you see in the bottom left, and the same young man up top, bottom right, same young man at the top with his little daughter. So I was there for 3 days with these young men, teaching them and getting them certified in the On My Shoulders curriculum. Rose made a conscious decision to adopt the On My Shoulders fatherhood curriculum so that both Rose and ROBE, as we travel around the country and engage men, we have evidence-based information, strategies, and skills to offer with regards to their family relationships, their parenting, and their co-parenting. So it was a real treat to bring the On My Shoulders fatherhood curriculum into the breastfeeding space. It really meant a lot to me, and I'm anxious to see as the next 6-12 months roll out how that curriculum fares in this space. I mean, now I'm a co-author of it, so of course I'm biased, but I just think the emphasis and focus on father's awareness of himself, father's awareness of his impact on his children's life, and his need to be connected and in good relationship with the mom, as well as other important people in their life. I think that lends itself to helping fathers to be even better at supporting mom in the breastfeeding practice. Okay. So this is a little ad that we put together. Real men encourage breastfeeding. So you see, breastfeeding is the norm. We're outside. Mom is feeding the child, and the idea in the picture is the other guy is letting the other guy on the far right know, hey, this is it. This is okay. This is what we do. This is what's natural. This is how we can feed our infants when we make the decision to do so, and it's right to do so in all spaces. This is a great story here. This young man, I believe this is in a Mississippi hospital. The young man has his newborn child skin to skin with him, and this occurred. This wasn't something that was planned. The mom needed to get some medical attention after delivery, and the father and his mother stepped up and made sure that the baby got time with dad, skin to skin, as opposed to being whisked away to another location while mom receives the attention that she needed. And so this young man was so happy to be engaged with his newborn at that time. And very few fathers get an opportunity very soon after delivery to go skin to skin for a variety of reasons. But one of the things that we advocate for men is you want to get skin to skin with your newborn at the first best opportunity, right? So we want to make it a priority. That's something you do as soon as it makes sense, as soon as the conditions are right. You know, mom and baby are good. You want to get in there and get skin to skin. And again, we have to help hospitals, healthcare providers understand this too, because we have some evidence, some stories of how men in the birthing center, in the hospitals, are present but invisible. And it happens all too often. And so we want to not only help educate men, but if they can step up and they know what to ask for, what to say, and how to engage healthcare professionals about this, we want to educate the healthcare professionals as well. Make sure that they see dad and that they know dad. If he's present, they want to see him as an asset to mom and baby in that critical, sensitive time right after birth. And this is ROBE, getting in spaces. We like to get in spaces that work with communities to let them know why breastfeeding is important. This is in Miami, where we go to an area and we gather as many people from the local area as we can to engage about the work, to learn about the work they're doing, look for synergies, look for opportunities to support them. And then we're always looking for people to bring on to ROBE. Now, ROBE's a little less so, but ROBE is still growing. And so when we go places, we're interested in seeing if we can identify somebody to bring on board to help represent us in that location, but connect them to the larger ROBE wisdom, counsel, and work. Again, ROBE in many communities, the bottom left is actually our, at the top left, you can see our executive director, Wesley Bugg. Top left, he's the gentleman on the left. And the bottom, there's Wesley Bugg again with myself at a cooking class in Cincinnati. So I run the Fatherhood Collaborative of Hamilton County, and it's ROBE's, it's the way ROBE does business is to connect and partner with individuals and organizations and communities across the country. So ROBE is a partner with the Fatherhood Collaborative of Hamilton County. And so frequently, Wesley Bugg and other ROBE members come into Cincinnati to attend the meetings and to offer support in any way that they can. Another big thing we like to do is get into barbershops. So we have a a really good track record of getting in the barbershop, setting up conversations, doing health screenings, getting men engaged or engaging with men about the things that matter to them. And then when the opportunity presents itself, we can talk about infant feeding and maternal health and the things that matter for starting a family in a healthy way. And this is a theme that we roll with. We're the ones we've been waiting for. I mean, we can't, for the Black community to improve the breastfeeding initiation, duration, and exclusivity. We have to be the ones we're waiting for. We just have to be about Black breastfeeding. And so we take that message in, with no frills. We have to get this done. We need partners and allies and supporters from other communities, but at the same time, we have to engage each other in the Black community about breastfeeding, figure out what's in the way, and come up with strategies to remove those barriers to the Black community being more open, accepting, and supportive of breastfeeding. So this is the reality. When we talk about disparities, this is what we're dealing with. So everybody does not start with or have everything that they need. Some people are starting in a hole. Some people are starting kind of at a even level, and some are starting at higher places. And so the gaps, the disparities and the gaps start from the fact that we have to change this reality to one where everybody has what they need, not that all things are equal, that all things are equitable. And here I am at the Linda Smith's IBCLC exam prep course. This was at Southview Hospital in Dayton, Ohio, last September. I was really, really honored to be able to sit in on that course. It was Monday through Saturday, 56 hours. And I, as a certified lactation consultant, I don't have the other criteria to sit for the IBCLC exam, but when Linda Smith offered me a chance to sit in on the class, I jumped at it because it's on me to continue to learn and grow in my knowledge about breastfeeding. And it's the same attitude that the other Wisdom Council members take as well. So this was a real treat for me to be there. There were, about 50 women in the room, and they were from shocked to pleasantly surprised that a man was in the IBCLC exam prep course. But the impact of men being in these spaces is huge. So I'm wearing a T-shirt that where the concept for that T-shirt was designed by a ROBE Wisdom Council member out of New Orleans, Kevin Sherman, and I thought it was brilliant. He designed this T-shirt for his father's baby shower events that he has in New Orleans, which are hugely successful, counter to what some folks that he worked with down there thought in terms of men coming out for that. He'll have 160, 200 men at these baby showers, and these were the shirts that I think it was last year that they gave out. But during my week at Southview Hospital taking this course, the CEO of the hospital and his wife both visited the room with very, very sincere welcomes and offering their support and acknowledging how important they place breastfeeding in the care that they provide to their families. So the CEO who came down the first day, a couple of days later in the course, his wife came down to bring us some cookies, and she came to the front of the room and she was just beaming because I believe this was a first for that hospital to hold the exam prep course. So they were proud that they were doing it. They were proud and happy that we were in the room. So she came, she offered some cookies, she had some comments from the front of the room. I'm in the very back, last row, and she dutifully makes her way all the way back to me and gives me like a 40-second hug just to say thank you for being a man and being here. And it was so moving to me. It was so moving. So men, in these spaces can make a difference. And what I talked about earlier in terms of engaging physicians and educating them, I had an opportunity to go to Dayton Children's Hospital last December and do a presentation about engaging men about breastfeeding to a room full of pediatrics and residents. So it was a great opportunity set up by Dr. Janet Velasco, who's a long-term pediatrician at that hospital and a part of the Southwest Ohio Breastfeeding Coalition. And so that was a real treat for me to be in a room with the people who are going to be taking care of families and helping them understand how to engage men about breastfeeding. And they had a lot of questions, and a lot of thoughts that spoke to the fact that they never really thought about men and breastfeeding in this way. So that was an important opportunity for ROBE to get in front of pediatricians and residents about breastfeeding, but even more specifically about men and breastfeeding. Now, the picture on the left at the top, I'll just go ahead and spoiler alert, that's not me. But it represents an event that ROBE was asked to attend in Crawford, Mississippi. And it was very interesting. A IBCLC there put on this event. She's a farmer. And so she gathered other women farmers. It was amazing, this camaraderie and this power that these farmers had. But given that she's IBCLC, she wanted a breastfeeding component to it. She wanted that component to speak to men who attended the event, and so she invited ROBE down, and I had the opportunity to go down and attend that event in Crawford, Mississippi, out on a vegan farm. It was really incredible. The picture on the right is me in Columbus, Mississippi, which is about 40 minutes away from Crawford, which is out in the country. So I'm in the barber shop with the owner of the Jordan Barber and Style Shop there in Columbus, Mississippi. And Mr. Jordan allowed me to come into the shop and just engage his customers about breastfeeding. I laughed because, I knew that's what I was there to do, but once I got to the shop, he just walked me to it was a huge shop. It's a big barber shop, like 12 chairs. And it was a Saturday, and it was very busy. And he just walked me to the middle of the barber shop and said, "Hey, everybody, this is Calvin Williams. He's with Reaching Our Brothers Everywhere, and he's here to talk to you all about breastfeeding." He just walked away. I was like, "Oh, wow, what do I do now?" It wasn't like everybody was clapping or anything. So I sat down next to one of the customers and just started engaging in casual conversation, not immediately talking about breastfeeding, but eventually did get around to talking about breastfeeding. And I did that with probably about 8 different customers, just side by side in the chairs as they were waiting to get their haircuts. So it was a really, really good engagement to that point in the barbershop there in Columbus, Mississippi. Well, towards my time to leave, I stood up and I just was saying goodbye to Mr. Jordan. A barber from the other side of the room, in a loud talking type of way, just says, "So tell me, what attitude should men have about breastfeeding?" And inside, I'm like, "Oh, great, this is perfect." And so there I am, standing in the center of the barbershop, and I answered his question and other questions that he kept coming up with. So it was really playfully kind of challenging me, being loud, but just, trying to ask questions that he probably never had a chance to ask anyone. But after a few minutes engaging him, I noticed that all the barbers and all the customers in the chairs are now engaging in the conversation. So here I am in the middle of this busy barber shop on a Saturday for about 15 minutes, engaging the customers and the customers that are in the chairs and the barbers cutting their hair about breastfeeding. It was a beautiful moment. The conversation got lively, and it did turn into guys started asking questions they probably never been able to ask before or knew to ask. And it was a lively and fun exchange with these men in that barbershop about breastfeeding. That was a really, really, really good event. Also met Mr. Jordan's son, who's a barber in the shop, and he told me that his wife just stopped breastfeeding, and it was against his desire for her to continue to do so. They talked about that she was experiencing some pain, and I inquired, about what type of support she had. I mean, where were you all turning? And he talked about the nurses at the hospital saying they were very supportive. But I pressed a little bit more to understand what type of family or community support that his wife had. And it seemed that they either didn't know where to go to get the community-based support, or there was no community-based support that she could turn to. And he stated that his efforts to get her to continue breastfeeding ended when, during a talk with his mother and his wife about it, his wife became upset and started crying. And his mother blurted out to Mr. Jordan's son, "You were formula fed and you turned out okay." And he turned to me and he said, "I knew I was dead then, Mr. Williams." But he said his wife, I asked him, "How long did your wife breastfeed?" He said she breastfed for 2 months. And I praised him for that and stressed to him that any breastfeeding is better than none, and that you did a good job as a partner to your wife in supporting the goals for breastfeeding that she had. And I think that's it for me.
Awesome. Thank you so much, Mr. Williams, for your presentation. This is Amelia Pismais with USBC, and I've got a few questions if you are willing to engage with our audience a bit. Wonderful. So, we reached out to you and asked you to be featured on this webinar, both because, this is a collective impact webinar series where we look at the importance of engagement and collaboration, but also, of course, because it's Black History Month. And we knew that ROBE and Rose, being leaders in that spaces, were really going to be able to give us great examples of how to be listening through those lenses. So first, I just wanted to share a comment that, how important it is that I heard you say that it's really important that when you're engaging with families, that you're listening through the lens of the impact of racism. And I wondered if you wanted to say anything more about how does that translate? How does that work for you when you're with a family and you're listening to their story and their experience? What does that lens look like?
Well, racism and poverty seem to really mix. And when I'm engaging families, one, I want to acknowledge their experiences. So I'm not there to judge or pump up or minimize their experiences as they describe them. We know that racism can be a very insidious disease, if you will. And so it's not that families are overtly talking about, here's what's happened to me racially, but, one thing that I do is I try to understand that the broader experience can be their experience as well. And racism is about people actually either being oppressed, feeling oppressed. And so what we want to do is try to uplift and encourage people by being culturally appropriate, letting them know. I heard at the Rose strategic meetings this past December, it wasn't a presentation, just a Rose staff member just blurted out, "We know how to love on people. We know how to connect with people." And that really struck me, is that's what we do. And I think people feel that, right? Because our platform is coming in like we're not experts. We're not here to provide answers. We're here to connect with you, to get to know you, and yes, quite frankly, to love on you. And so people feel that, and then it gives people an opportunity to share whatever they think is important in their life, and whatever they think is important, including racism, as it affects their ability to raise their families. in the ways that they want to. So I think the main thing we do is wrapped up in Tanisha Sellers' comment that, we know how to love on people. And matter of fact, as a fatherhood practitioner for over 20 years, when I first started this work, I had no staff. And when I hired my first staff person, the first thing I told them was, you have to love them. You have to love the fathers we serve. And that's all I had to work with. But that young man is now vice president of a very prominent nonprofit here, and he still says that to this day.
That's so beautiful. Well, and it seems like there's this very thoughtful approach that you have at Rose and at ROBE to take that spirit of love and the way that you hold the people that you engage with, and then also look across your programs at how to operationalize that. So we noticed you've got these 4 pillars going: the policy, partners, parents, and peers. Can you say a little bit about why it's so important that you approach your work from all 4 of those pillars?
Well, we took that guidance straight from the Surgeon General's call to action and adopted it as a best practice way to work, and it also fit the way we want to work, right? So we want to be in partnership. We want to develop peer leadership and peer support everywhere we go. That's why the Rose does community transformers trainings, which now Rose has the first men trained as community transformers. That happened late last year. So, and we know that the real impact is in policy, and so we have to find our way into the spaces, find allies that can help us be engaged in policy, such as being a part of scholarly articles, being a part of county or statewide breastfeeding coalitions, being a part of extending breastfeeding into the business community. What type of policies should businesses be thinking about to support breastfeeding? So it all makes sense to us, because it made sense to the Surgeon General back then to line it up that way, and it fit with the way we think about things and the way we want to do things.
Beautiful. Yeah, I hear a real heart and hands and head of kind of approach, which is really rich and effective. So we have a few questions here about your fatherhood curriculum, and I want to connect them, and then you can take them as you like. So it was so powerful when we heard you say that men are present but invisible. And so I'd love to hear anything about, what would you recommend or ask, advocates who have any opportunity spaces to be able to make men visible? What would your ask or your recommendation be?
I would say when you see men in the spaces, if you're a healthcare professional, if it's the prenatal care space, if it's the labor and delivery space, you see men in the space, engage them, look them in the eye and engage them. Men are, not all men, of course, but particularly men of color and poor men who are used to not being seen and heard. They're kind of looking for that, right? They're sealed inside, kind of waiting to be second guessed, treated as second best, second hand, that type of thing in those spaces. So it is refreshing, invigorating, and empowering when a healthcare professional looks at the family and turns to the man and asks critical questions, asks his opinion. Even just looking at him is really important. And so you can really uplift a man, make a statement to your other coworkers that this is what we're about. We're about the whole family. The other thing I would say is men are really interested in what they can do to help, right? And so it's less helpful to talk to men glowingly about the importance and the benefits of breastfeeding, and it's more helpful for them to say, hey, here are all these benefits, here's the importance of this, but here are some things that you can do, here are some things you can look out for, here's ways you can support mom and baby, and here are some benefits to you, right? So that's really important to them. One, being engaged with sincerity, and then being given information about how they can do their part, because men are doers.
Nice. Well, so we're curious about the On My Shoulders curriculum that you talked about. So, you know, there's a role that all of us can play in seeing men and engaging with them and really acknowledging their presence and their role. Within your curriculum, are you bringing that out to communities to make more leaders, or like what's the role of that curriculum, or what could you share about some of the content?
Yeah, On My Shoulders is really aimed at helping men be in better relationship with themselves, with their children, the mother of their children, and other important people in their life. So it's kind of like takes an ecological approach that father and child may be at the center, or father, child, mom may be at the center, but there are other relationships with family members, even work relationships, friendships that can impact how that father parents his child. So it's really about relationships, about helping men see themselves more authentically, more clearly. And it's a curriculum that doesn't tell men what to do or how to be, but it's about exploring things that men typically don't talk about, like attachment and nurturing trust. That's a unit that I'm really proud is in On My Shoulders, because it gives men a chance to talk about, to learn about how children attach. It gives men a chance to think about their own attachment style and how that's affecting them as adults in their relationship lives. Free to Be is a unit that talks about manhood. Again, not laying anything on men, but just kind of unpacking manhood with a kind of let's see how we got here thing. And what are some things in this manhood journey that we'd rather not ascribe to anymore? What are some things that are getting in the way of us leading more fuller and healthier lives? We talk about safety. The whole curriculum is the foundation of safety. And we talk about 4 types of safety. People think safety is just physical safety, but we like to talk about physical safety, emotional safety, commitment safety, and community safety. So men get to broaden your definition of safety. We talk about personalities. We do the colors personality assessment tool in the curriculum to help men see themselves through that tool, and to see the mother of their children and their children through a personality lens, to help them think about ways to be more effective at communicating with and engaging with their families. It's a curriculum that talks about communication, so 2 heavy units on talking and listening, skillful talking and skillful listening, given that the main, the heart of any relationship is how well we communicate, and the key to healthy communication is safety. Are people safe in the communication situation? We want men to understand that. We also talk about how men can get what they need, which is, it's another communication unit, but it's different in the sense that we're giving men a chance to see how they go about getting their needs met and what communication styles they may be using, but they're unaware of, and the communication style is what's causing the lack of success for when they're seeking to get their needs met. There's road mapping, where we ask men to go back from birth to the current time and plot out the highs and lows in their lives in a very specific way. We call it road mapping. They plot this out, and then we examine some of those positive and negative events in terms of who are the other people involved in those events. What did we learn about those people? What did those people mean to us? We examine them in terms of how did those events shape us as men and fathers? So it's a really rich curriculum that's very heavy on activities. And so it's the activities in the workbook, and it's the conversations and engagements that the men have between themselves that really make this work. I'm really, really proud of On My Shoulders.
Oh, that sounds so rich, so fantastic. You know, I think if we understand what kind of cumulative experiences formed and shaped us, it just automatically makes us so much more aware of the impact of what we're doing with our own children and how that's shaping them. So I'm so glad that you are out there doing this work and that you found a way to integrate that into the larger breastfeeding work that Rose and Robe are both doing. Mm-hmm. So yep. I think with that, we're gonna wrap up today with our thanks. There's many comments about just thanking you for your great work and presentation, and how needed and vital it is to have men and fathers present and leading our communities. So thank you so much for your time today.
Oh, my pleasure. Thanks to you all.
Wonderful. All right. So now I'll turn it back over to Alyssa for a few USBC announcements.
Great. Thank you, Calvin, and thank you, Amelia. So just wanted to let you guys know about a couple of upcoming webinars that we have. So on Monday, March 2nd is the rescheduled racial equity webinar. So that is going to be again on next Monday from 2 to 3:30 p.m. Eastern Time. And we're excited to have Kadada Green from Black Mothers Breastfeeding Association on to present about envisioning a breastfeeding friendly system 2.0. And then later in March, we have the Power Tools webinar on Wednesday, March 18th from 2 to 3:30 Eastern Time. And we have Lisa Akers from the Union Institute and University looking at ethical leadership and what does that mean for my organization. So we've got a couple of great webinars coming up that we're excited. So I hope you're all registered and going to attend those. And last, before we sign up, we have some updates about our national conference this June. So wanted to share that on our website, marketing information is available now, and there's a lot of options and various price points for different folks and organizations for exhibiting, sponsoring, or advertising. And so if you or your organization is interested in any of these marketing options, you can apply online on our website. And so if you go to our website and check out the conference link. We're also really excited to share that registration is going to be open very soon in early March. And so you should look out in your emails for information about registration for the conference coming very soon. So we hope to see you all there in person in Arizona in a few months. So with that, I want to thank everybody for being here with us today, and thanks again to our wonderful presenter, and stay in touch with USBC. We can't do this work without you. All right, have a great day, everyone.